Dr. Omar Anguiano here again.
Dr. Todd Pickman, both of us from Gonstead Spine and Wellness here in beautiful Meridian, Idaho.
Today we're discussing carpal tunnel syndrome. Now, what is carpal tunnel? We know that it's in the wrist, and many of my patients believe that carpal tunnel syndrome is the problem is there's something wrong with their wrist. So the doctor, the typical treatment is the doctor goes in here and they do a surgery and they remove tissue from there. Is that an effective way to deal with this?
Well, here's the deal with carpal tunnel syndrome. This is an interesting topic, Dr. Omar, is that this is what's classified as a triple crush syndrome, meaning there's 3 different spots that the nerve can be crushed, causing the pain. Now, what nerves are we talking about? Well, Dr. Omar's showing that the nerves in the wrist, they go up the arm, and they actually originate from the lower neck. Okay, so the lower neck area is the first crush, and that's the first most common area where the nerves actually get impinged, causing the symptoms. So that's number one. That's the first part of the crush. The second one, the second crush, is typically down in the elbow. Okay, and then the third one is in the wrist. So tell me about this, is that how often do you see a carpal tunnel syndrome issue and they have an elbow subluxation, elbow misalignment, or a neck misalignment, neck subluxation?
Oh, huge.
It's almost every time.
Yeah.
Right? And then so much so, where do you normally see these carpal tunnel syndrome issues? Someone that's in what kind of working position or activity?
Usually repetitive, people that cut hair or dentists that are kind of doing this sort of thing.
So people think, they think, well, I'm having this carpal tunnel problem because I'm always using my wrist, but they forget of the fact that what position is their neck and their shoulders and their elbows in that whole time? And they're usually in this messed up position. They've caused the problem elsewhere. This is the innocent bystander. And so, of course, if you go and cut the flexor retinaculum and open this whole section up and make the wrist unstable, it's going to decompress the nerve and it's going to feel better. But is that really the cause of the problem?
Now, are you saying poor posture? Could poor posture affect your neck?
Absolutely. Absolutely. And there's another area too where these nerves can get irritated outside of this triple crush in what's called the thoracic outlet. So now in the thoracic outlet, you have a muscle, you have clavicle, and you have a first rib. So you have 2 bones and you have a muscle that make this triangle that the brachial plexus, or these 5 nerves, pass through. And when the head comes forward, the muscular component of that gets tight and it makes that triangle smaller. They call that thoracic outlet syndrome, which is also something that there's a lot of people that think that the solution is surgical, when the solution, you can open up the thoracic outlet in a lot of cases just by improving the posture and getting the muscle to relax.
Yeah. So what should people do if they're having carpal tunnel syndrome? What or symptoms? What would you suggest?
So first off, I wouldn't jump to any conclusions thinking that you need surgery. I would do your due diligence. You can go and you can see a hand specialist, you can see an orthopedist, but I would also see someone that specializes in looking at the spine. And I would, of course, I'm biased, but I would look at someone that takes x-ray of the spine, that does a very specific approach, that can analyze and see, is there anywhere else in that path that nerve can be impinged? There's a saying, and they say that if all you have is a hammer, everything looks like a nail. So it's no offense to our other colleagues in healthcare, but if they are so focused on one thing, like all they do is look at the wrist all day long, and you have a wrist complaint, your problem might be in the wrist.
Yeah.
Right?
Yeah. I hope you enjoyed this video. If you did, please hit the subscribe button below, where you'll also find a very special link to an offer. What is this offer?
Well, it's a special offer. Like you said, it's very special. And it's only for our loyal YouTube subscribers. So make sure you check into that. We'll keep you in suspense, and we'll see you real soon.
Very good. Have a great day, guys. See you next time. Bye-bye.